Today, we're digging into something we're calling the 13-day question. It's a story about a system of care that people rely on. What happens when that system breaks down, and a really fundamental question. When it all falls apart, who pays the price?
To really get to the bottom of this, we have to start with some pretty big questions. Simple ones, like, what is justice?
Here's another one. Do you have to pay for work that has already been done? Seems straightforward, right?
And maybe the most specific question here. What happens to public funds, money that's been budgeted to support a person with a disability, if that money never actually gets to them?
Every single one of those questions really boils down to this one number, 139. That's 139 days of housing, food, support, and safety that were provided by caregivers, all with zero funding. That number, 139, is the anchor for this entire story.
All right, so let's get into the details. For those 139 days, caregivers went completely unpaid. The agency they worked with, IFRC, said it wasn't their job to pay them. And the public funder, Community Living BC, or CLBC, they also refused to compensate them. So, with no other options, the whole thing ends up in court.
And then we get a huge development. On February 5th, 2025, the court makes a really critical decision. It orders the public funder, CLBC, to be added as a defendant. The reasoning was pretty simple, really. The agency, IFRC, had been arguing all along that the money belongs to CLBC. So the court basically said, okay then, let's get CLBC in here to explain their role.
And this is where the story takes a fascinating turn. Because the moment the public funder is ordered to join the case, the agency that was already there makes a very, very sudden move.
Just look at the timeline here, especially those last two dates. It's really revealing. February 5th, the court orders CLBC in. And then, bam, just a few weeks later, on March 26th, IFRC files an application to get out. The timing is everything here, and it begs the question, why now?
This visual really says it all, doesn't it? As CLBC is being brought in through one door, IFRC is immediately trying to slip out through another. It's a move that you just have to look at more closely.
So what exactly was in that application? Well, IFRC asked the court for three things. First, take us out of the case completely. Second, declare that the claim against us has no merit. And third, make CLBC fully and solely responsible for everything.
And that move right there forces us to ask a really core question. What was IFRC's actual role in all of this? See, they claimed they were just a bookkeeper, a simple administrator just passing funds along. But their actions tell a completely different story.
In their own legal filings, IFRC's position is pretty blunt. They flat out say the caregivers have no evidence or valid reason for the claim. The argument is basically, hey, we were just the middleman, so we have no real obligation here.
But okay, let's put what they say next to what they did. On one side, they say, we just passed the funding through. But on the other side, we see them issuing a formal notice of withdrawal, imposing very specific contract conditions like a WorkSafe BC account, and being directly involved in how the care was structured. That looks a whole lot more like a service provider than just a bookkeeper.
And let's zero in on that WorkSafe BC requirement because it's so important. The entire relationship ended because the provider refused to meet this condition, a condition that was imposed by IFRC, not CLBC. In fact, at the time, there was no official CLBC policy that even required it. So you have to ask yourself, who is really setting the rules here?
So when you actually map out their role, you see care coordination, collecting reports, giving instructions. That's a lot more hands-on than just wiring money from one bank account to another.
So IFRC tries to just walk away from the whole thing. How did the court respond to that?
Well, on one side, you have IFRC's application to get out, and on the other, you have the court's answer. And that answer was, essentially, not so fast.
Here's what the court decided, broken down into three key points. 1, IFRC is not being removed as a defendant. 2, we're going to postpone even considering their request to leave. And 3, this is the big one. The case is going to move forward with both IFRC and CLBC as defendants.
The court was sending a really clear message here. Responsibility can't be turned into a game of hot potato, where you just toss it back and forth hoping someone else gets stuck with it. No, both parties had to stay at the table.
And having everyone at that table really shines a light on something else. A pretty stark imbalance of power. And this is crucial for understanding what's at stake for the people involved.
I mean, this image makes it crystal clear. On one side of this dispute, you have two caregivers, people who paid for 139 days of care out of their own pockets. And on the other side, you have the full professional legal teams of a service agency and a government-funded crown corporation.
And this is what's really being weighed in the balance. On one scale, you've got those 139 days of real, tangible care, housing, food, transportation. And on the other scale, you have this question of shared legal responsibility between an agency and a public funder.
Look, IFRC's move to exit right at that specific moment leaves us with some pretty sharp questions. Why try to leave the very second CLBC is brought in? Is this just about the money for the 139 days? Or is it about avoiding a formal court ruling that says they were responsible? Or is this a tactic to push the whole burden onto CLBC, a much bigger player that's a lot harder to sue?
And that all leads us to the final and I think most important question of all. When a system like this one breaks, who is it really designed to protect first? The institutions and the organizations, or the people on the ground who actually did the work?